Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. All right. Hello, everybody. Crystal Stokes here. And joining me today is Dr. Greg Bishop, who is a veterinarian, cartoonist, and writer based in Portland, Oregon, known for his engaging blog at www.sasquatchpaw.com, where he combines his expertise in animal care with a unique, humorous perspective. With a focus on both practical and peculiar aspects of veterinary medicine, Greg offers insights and stories that resonate with both professional and pet owners alike. His work reflects a deep commitment to animal welfare and an appreciation for the quirks of life with pets. Greg, thanks for being here with us today.
Happy to be here. Thank you for having me.
And also while you're traveling, so that's even extra effort. You get an A++ for that.
I'm committed to the podcast.
Thank you. Well, so before we dive into the topic today, which is actually about nonviolent communication in vet med, it's a very interesting topic. I just want to hear a little bit about what life was like before you ever came into contact with nonviolent communication. Like, paint the picture of the life of Dr. Greg Bishop as a veterinarian pre-nonviolent communication.
Yeah. I grew up in San Diego, and it's kind of known for its just laid back culture. So I didn't have huge problems just dealing with upset clients or with, a lot of upset people. And so when I became a vet, I kind of was drawn to a little bit of the just weirdness that happens with the clients. And I did an internship in Long Island, and we just had I've got great friends in Long Island. I mean, no disrespect, but there are some characters out there, and there was just all sorts of wild stuff, working overnights in the internship. So I kind of would get drawn to these interesting characters, human characters that would come in. But we all know at some point, if you're working in the field, like, somebody's going to get mad at you. They're going to start to say personal attacks on you. And so there were times where I kind of felt okay with it, could still do my job. And there were times where it would start to get under my skin. And then I would start to tell this story of this client being a jerk or just rude or whatever. And it didn't happen that much, I guess, but there were definitely plenty of people that were just difficult for me to deal with. And then when I came across this nonviolent communication strategy, it really took those people and it completely reshaped how I look at them, and it completely changed the interactions that I would have with them. So now, even though I was a little bit drawn to the strange people that would come in, or to the people that honestly were like a little bit rude, now I'm even more so. I'm even more like, oh my gosh, like, I want to go talk to them. Like, I wonder if I can work with them and kind of get them onto our side and turn them into a purring kitty rather than a ferocious tiger. And that's where all the fun of it is for me.
Oh, I really appreciate that. So if I say it back, I think that what you experience is probably what many people entering to the profession experience of maybe not having that many encounters with people who are upset or angry or really anxious or maybe even hysterical, depending on what the situation involves. And I think many people have a natural reaction, sort of move away from that, maybe avoid it or hide from it. You seem to have a natural curiosity where you're like, well, I'm kind of drawn to this for some reason, but also feel like you're in territory that wasn't really familiar since you grew up in a place that didn't give you a lot of exposure to those types of situations.
Yeah. I always think about it like growing up, going in the ocean a lot. I love surfing because basically if you fall surfing and you get rolled over by a wave, it just passes right through. It's it's scary, but you don't actually get hurt. And as long as you just kind of trust your breath and trust yourself, you just have to relax a little bit and you'll come out of almost any scary situation. And so that was kind of something that I would think about in these moments of like, whoa, my autonomic nervous system is kind of firing right now. But I'm going to be okay. This person is really mad, but they're not going to physically harm me. I can just talk to them and work through it.
Got it. So if we're going to like pre-nonviolent communication, at that point, you were still kind of finding these clients mysterious and you didn't necessarily feel comfortable or confident with how to move forward with them. And you kind of mentioned this transformation that as you learned nonviolent communication, you started to see these people through a different lens that made you want to approach them even more. Would you say it gave you a kind of confidence? Like, I kind of know what to do now, or I don't know exactly what to do, but I know how to enter in?
Definitely. Yeah, definitely like kind of formalize a lot of stuff that I feel like I had observed from working with clients a lot, but it did give me a real strategy for how to think about it and get through it.
I might be getting ahead of myself in terms of, your evolution and journey, but I'm curious, were you already a cartoonist at that time before you had discovered nonviolent communication?
Yeah. I've been cartooning since I was a kid. So my first series was about like a group of vegetables that are superheroes and go solve problems. And it's really bad. And I have a couple saved somewhere in my basement, but I've always, in middle school and college and vet school, like I would draw cartoons based on whatever was going on in my life at that point. And so, yeah, I've always done that. But now I'm kind of getting really into the trying to formalize my education in cartoons to a degree where I'm like really trying to study from people that are good at it and really think about it, take it more seriously, which is a funny thing to take cartooning very seriously, but it's a real art form with lots of intrinsic rules that are helpful to know. And I think it's a great it's a great means of communication because it's the joke that you can tell, and jokes are a great way to sort of diffuse tense situations. So yeah, and I can do cartooning for a veterinary audience, and that has been well received, and people are really happy to see that stuff out there. So I'm glad to be doing it.
It's really cool because I was curious if your cartoons that were vet med based have changed as you learned nonviolent communication. Did it shape the content of your vet med cartoons?
Yeah, I think so. It's because it's like before when you're upset about a client interaction in a pre-nonviolent way, what a mouthful of just a way to say that. But in a pre-nonviolent communication way, I would be thinking about a joke, and I wouldn't even be aware that the butt of the joke was the client, the client doing something rude or stupid or obnoxious. And now I try to think about that. And you really want a joke that is as inclusive as possible. It's childish, immature humor to make fun of a specific target group of people. But if you have an inclusive joke that everyone can laugh at, and if it's even better and it can say something that, brings a new idea to somebody, that's really wonderful. So it's made me much more conscious of sort of who I'm poking fun at with the cartoons.
That's lovely. All right, so let's dig in to the meat and potatoes of nonviolent communication. For those who have never heard this before, can you describe from your experience what that is? We don't need like fancy definitions necessarily, but how would you describe it to a lay population?
Yeah, I think it's really just a way to talk to somebody where you are really strongly aware of your own emotional experience. And that's important because the whole time that you're talking, you're supposed to be thinking about what are my needs and what are the other person's needs. And your needs really can't be about them doing something specific for you. They're always talking about like keeping it vertical. What do I need? What is my own situation? How can I act like a grown-up here and sort of still be satisfied with this without telling somebody else that they have to think or behave or act in a certain way? Because we all know, and I've got a 7-year-old and a 4-year-old, and I'm a 41-year-old, none of us like to be told what to do, and we're going to be strongly resistant to it. But if we're invited in a way that says, hey, listen, we can be partners here. I have needs, you have needs. Is there a way for us to all get our needs met? And if both parties are approaching it that way, then you really can sort of separate all this taking it personal stuff and see every communication as an opportunity to collaborate. And that's the beauty of it. You don't need to. It goes much faster if both people are doing it really well. It's not easy, but even if one person is doing it well, which is the approach that I take most of the time in the veterinary clinic, it still really helps because you're just sort of separating out these emotional reactions to how people typically communicate, which is with a lot of it's called violence, but it's really like an intention to make somebody feel guilty or ashamed or bad about how they're acting. And it can be really subtle and it can be really confusing. And so nonviolent communication gives the person practicing it like a little bit of a shield that says, hey, you really can't, no matter what you say, it won't ruin my day. You can call me a horrible vet, you can call me greedy, you can call me whatever. I understand these things aren't really about me because I know that I'm none of those things, but I can also still help you. And that's that's a pretty beautiful big picture look at it, which was really appealing.
Okay. And then how did you discover nonviolent communication?
Through a personal therapist who had recommended Marshall Rosenberg, who founded it in the 80s, I think. So he talked to us about it. And I watched the video of the guy playing with puppets on YouTube. I went, whoa. But boy, when I started to just really pay attention to it and recognize the power that had, I became obnoxious and started telling everybody I know, hey, you got to do this, you got to do this, you got to do this, because it's so dang amazing.
You have the NBC tattooed on your wrist, all the way.
Yeah. I'm walking around the sidewalks, passing out cards. You got to, and they're like, what are you selling? And I'm like, great conversations, a better world.
It's true. I know. So once you practice something like this, there's really no going back. It really shifts. I would say it's like the Matrix. You take the blue pill and you wake up and you think, oh my gosh, why didn't somebody tell me about this way of communicating that makes things just so much more pleasurable and palatable? I think that we get scared when we realize we're in a situation where the other person is not happy. And we often resort to old strategies that we learned, who knows where, just somewhere when we were younger, because it was previous to this point now. And that's what we use. We model that, and it's not very effective. So I think it'd be nice to paint the picture for those people who are listening. I'd say this is an invitation. If you find that you dread those client conversations that are uncomfortable, that are tense, or there could be any heightened emotions, that those are things that feel uncomfortable for you, this might be something for you to explore. And I'd love, Greg, for you to share some examples that you think this audience would relate to, that they commonly have occur in their hospital or clinic.
Yeah. So so right now, I do relief, but most of my work is in an ER clinic that's pretty busy, and there's a lot of people there. And most of the time we're charting in a room that's slightly off from the main treatment area, but we have reception going back and forth. We have staff going back and forth. We've got people going in and out. Anyway, usually as everyone's working on their stuff, you can kind of get a sense of, you'll always get a sense of if there's a client who is just difficult, problematic, use whatever euphemism you want for that. But everybody in the whole hospital is going to start to hear about that when this is going on. So reception will come back and they'll say, ooh, we got a hot one here. And then the nurse will go to triage, and then the nurse will come back and be like, whoa, that's intense. And so you start to ramp up your expectations of when you go in. But when I'm hearing that, I'm like, I can't wait. I'm so excited to go in to talk to them, because I just want to find out what's going on with this person. Why are they what is driving this behavior? And the funny thing is that if they're in the vet clinic, it's 99.99% of the time going to be because they're worried about their pet. And that's the thing. That is the point of trust that you want to maximize right away. So people don't know what's happening when they get there. They're not sure who they can trust. They've heard stories that vets are greedy. They've heard horror stories about pets dying. They're freaked out. And yeah, exactly. They just utilize this behavior that they learned, at some point that seemed to help. But when I'm hearing that there's a difficult client, I'm starting to think, okay, let's go find out. Let's go find out what they want. They want to help their pet. Let's go find out how we can help their pet. And I had a client that I don't know if you want me to share a little story.
I would love actually, yeah, like real life stories, maybe a few would be really helpful, like different types of clients and conversations.
Yeah. I had a client who was I work with a colleague who's really wonderful, really nice, really patient. But this client was his client, and she had a young lab puppy who had massively overdosed on a muscle relaxant and was really, really critically ill. And we were working to save him. And we're trying to do all the things that we have to do, figure out what are the appropriate treatments, figure out how much money we're allowed to spend of the client's money in order to help with this, come up with a prognosis, communicate that, get informed consent, figure out contingency plan, all this stuff that requires really crystal clear communication. And the client was unbelievably difficult to deal with. So my very patient colleague lost it, and he was on the phone, and he just kind of yelled and slammed the phone down, and that really shut everybody down because they were thinking oh my God, if he's done with it, this client must be atrocious. So I offered to take over the case management because the treatments were already going, and it really was just a matter of communication. And so one, it's easy for me, right? I don't have a relationship with this woman. She didn't say anything mean to me, but I was able to get on the phone with her, and just literally the first 5 minutes were just a tirade of how awful everybody was. Really, this woman had learned every trick in the book about trying to needle into weak points and trigger a reaction. And when you're approaching this with nonviolent communication lens, you're really trying to figure out, what does she need? What does she need? Do I need to get respect from her? I don't really. I can have self-respect. Do I need compliments from her on myself? No. She can accuse me of whatever. I'm self-aware enough to not let that trigger a negative emotional reaction from me. And I just basically was on the phone for 10 minutes, just listening, trying to figure out, when there was a pause, I would try to, say, okay, do you mean this? Do you mean that? And just representing her needs, because in that torrent of, crap, 1% of it was communication about what she wanted. What's wrong with my dog? What's his prognosis? And so, yeah, so that first 10 minutes was just I was all right, I just got hit by a big wave. I'm just gonna lay here and kind of be patient, and eventually I'll be able to come up for air. And she did. And most clients, if you just give them space to kind of run their mouths and do all that, and you just listen and you accept it, it's going to be over fast. Most people are grown-ups where they'll expend all their energy, and then you can come in and say, all right, you're super concerned about your pup. Here's why it's concerning. We're not sure about this. We can do this and this. Now I can't change certain things. I really can't change how much toxin was absorbed because it's in his system. We can't get it out. There is no antidote for this. So here's the plan that we need to do. Here are the risks that are going to be involved. And that was a difficult conversation to get all that across. But one of the things I kept reminding her of during the procedure or during the phone call was that, she could really help by staying as calm as possible. So I was kind of giving her a coaching on this communication strategy as we went on. And I said, listen, he needs you. He can sense your emotions, maybe not at the level of toxicity they had, but seemed to be a helpful thing to say at the time. and just kind of reminding her that if she stayed calm, she could hear what I was telling her, and that would help her make decisions that she could tell me. And if I stayed calm, I could listen to her. And so it really did take this nasty, nasty human energy down to a just more calm state. And fortunately, it's a little bit of a sad ending to the story, but not a really sad ending, because the puppy did great. And I did not think this was going to happen. I rounded off to a colleague. The next day, I heard the puppy was doing much better, went home. It was one of those cases where I was like, yes, because we had done a couple of things we weren't quite sure about. We were hoping it would work. Anyway, went home, but unfortunately, the woman left a really nasty review afterwards. So I was hoping she would have this epiphany. Oh my God, I was so nervous about my puppy, and I acted like a big jerk. But hopefully that experience, even if it didn't lead to a good review, stuck with her, and she remembered, hey, I was able to calm down. I was able to get help, and eventually it gets better.
That is a great example. For those listening that might be imagining themselves entering a room and trying to allow the client to have space, or they're on the phone trying to allow the client to have space to initially vent as they were for that 5 to 10 minutes. Do you have any pro tips for that stage of how to manage your own inner response to that? Because I think it's very natural that our nervous system gets really upregulated. We start to sweat, our heart starts to beat, our breathing gets shallow, our mind is racing, but what about that? Oh, just all of our rebuttals are building in our mind. So how do you process all that's going on when you're receiving kind of a gush of that kind of negative feedback?
Yeah, I think fortunately, we all have training in animal behavior. So I just go, the animal that you're currently working with is a large bipedal primate that has a lot of intense feelings, and they use aggressive language to try to coerce somebody. So enter the room as though you're dealing with this animal that has this suite of behavioral characteristics. And if you just stay calm, the gorilla will charge and beat its chest, and you just have to stay calm and avert your eyes and not do anything threatening, and it'll pass. You have to remember that they are there for your help. They don't know how to do it, how to approach you in a calm, respectful way a lot of the times, but they really need your help. And so all you have to do is remind yourself that you're there to help them, because you are. You're not there to make their day worse. You're not there even to just treat their pet and not listen to them. It really matters what they think and how they feel about their pet for you to help them. That's the whole idea of the veterinarian client-patient relationship. They're an essential part of it. So you have to think of them as a partner. And then honestly, like some empathy, as you would have for a child throwing a tantrum. I mean, depending on how you feel about your kids. Like, I'm traveling with my kids right now, so my empathy is of variable degrees. But when you just understand the kid is throwing a tantrum because they're upset about something, and we've all been upset about something, and we've all acted like jerks. I think I've certainly done that as well. So that helps me sympathize with jerks. I go, well, they probably just feel bad about something. So it's just remembering all that stuff. They need help. You're there to help them. You've made mistakes. Just be patient. Give them a few minutes, and yeah, it's amazing. I mean, just the tone shifting from these people that come in to where they go from there is, you want to invite them to be or feel invited to be a better human, a better person, a better communicator, and just offer that, and don't take it away by retaliating with more violent communication.
Yeah, take the high road and say, would you like to join me? It's nice over here.
Yeah.
You have it in you. What about this pushback? I am way too busy to give somebody 10 minutes of time just to complain at me and yell at me. I don't have 10 minutes. What would you say to that?
It's the only way. I mean, it's like it's in the ocean. You can struggle all you want, but it's not any faster to go that way. So I just genuinely believe that. I think, like, unless I have this client's trust, it's going to be a headache. And I learned that the hard way, by trying to take shortcuts and get around and just say, oh, okay, just give them this, give them that. But when you can tell that somebody's upset with you, a client is upset with you, you have to go back and lay the trust foundation before moving forward. If it's going to take 10 minutes, it's going to take 10 minutes. It doesn't mean you have to stop surgery and step out and do that. But at some point, you're going to have to get on the phone or get in the room with the person and just listen for 10 minutes. And it's not that hard. It's something where if you resist it, it's just vastly harder than if you just go along with it. But
yeah, so I 100% agree with you. I just wondered how you would answer that question. Do you have steps that you like to take if you're trying to bring this to new team members? Let's say you have like a couple new technicians that have not experienced nonviolent communication. Do you have a 1, 2, 3 plan for them, or how do you like to educate people on it?
We try to be, I think the earliest thing that happens is we start to tell ourselves a story about this other person, that they're a jerk. And so one of the things is like, hey, let's try and be patient with people, try and be patient, and then look at yourself and go, try to be as self-confident as possible. It's really hard. I think unfortunately, with some of the staff, they can get rattled if somebody says they're greedy or they don't care, because they have much harder jobs. They're not getting paid a ton. It's just difficult. So I think just having the self-confidence of knowing why you're there, and it's the thing we tell kids, sticks and stones. So yeah, first is try to be understanding, try to be confident, and then the third one is try to pay attention to how your feelings are changing, right? If you're talking to somebody and you're going in there already knowing that they might do something consciously, subconsciously, whatever, to try and get you rattled or try and make you feel guilty. Well, if you are paying good attention to your own guilt reactions, then you can sort of snuff those out. But it's really easy to get subconsciously rattled and start to escalate it. So it takes practice. And the other thing is, like, even applying this a little bit into the client interactions you have right now will make them better. And then however many chances you get to practice that per day, it doesn't take that long to really see a dramatic improvement in your communication. I think of it as like the health of the communication between the humans. And yeah, it just gets better. It's a pretty simple, pretty elegantly beautiful principle.
Yeah, I really like it. So when I'm imagining you all practicing this at your clinic, it seems like step one is just be aware of the label we place on the client. So before we even go into the room or get on the phone, try to just let go of the label of this is a difficult person or that person's a jerk. Go in with a more of a beginner's fresh mind and say, hey, just like me, if I'm having a bad day, I can be short and snappy, or I can be really anxious. So we're all humans here. This is a stressful situation. I'm going to give them some grace. Go in with a little more curiosity and an open mind and less judgment. Step one. It sounds like next, when you're in the room, you're trying to stay vertical. You're trying to say, why am I here? What's the purpose? I'm here to connect with that client and build trust. I'm here to find out what they need. What do they need most? And identify that need and try to address that need while taking care of the patient. And so I can see this sort of through line where everything else falls to the side. So you don't take the bait. If they're like, y'all are just greedy, you're like, you just set that aside, and do you even really know what you're doing? Like, how do you, try to, okay, set that aside. Okay. So I see you want to know that financially we can have a plan that we're going to work through, that you're confident in the medicine that's being done here. Like, you're just trying to find what is the need? What is the need? Anything else you just kind of set to the side until you get to the middle of whatever the thing is you're holding in your hand. And then it's like you're a team. You're like, is this the thing? Like, that's the thing. Oh, it is. We can work on this together. Like, let's come and be partners on figuring out this part for the best care of your pet, so we can all get through this together. We're all on team Save the Pet.
Yes.
That's why we are here. I think that gets forgotten about, that you all are on the same team, and nonviolent communication seems like a pathway to get back on the same page.
Yeah. And it's just kind of admitting that you're on the team. If you're going to have a relationship with this client, and I don't think this means that you can't ever like fire a client or just, say seek services elsewhere. But if you're going to be in that relationship, then yeah, the best thing is to be on the same team. Mm-hmm. And just because your teammate is acting in a way that you don't like, doesn't mean that you infighting will make it worse. And this is really easy to see again with my 7 and my 4-year-old. It's like, why are you fighting right now? But when you're a grown up and it's done in a much more subtle, much more manipulative way, it's harder to see. So it's that reminder that yes, we're on the same team. And then one of the really important things about your own self-awareness is knowing what you can do. And I think this is really, really hard for new grads. And I would say it was a huge problem for me my first few years out, because you really don't know. You're not confident really in your skills. And so you're thinking that you're going to make a mistake or going to overcharge. You're going to, and knowing that mistakes are part of the process of medicine, especially veterinary medicine, is just, it's really hard, but it's really important. So that helps you understand what you can and can't do to a good enough degree to be able to communicate it. And then, yeah, I think that's one other thing I want to say about that too, is you can explain to the client, all right, here's what I need from you right now. Here's what I need you to do, because we are on the same team, right? And that's after you've established the trust, after you've really crystallized the goal and saying, okay, I would love to keep popping in here every 45 seconds, but there are 20 different patients in the hospital. I need my attention here. I've got this going on. And once you have that trust, well, the client, of course, they're going to say, hey, this person's on my team. They're trying to help my pet who I care about. And so, okay, well, that sounds reasonable. I'm going to try my hardest now to let them, have their time and do their thing. And yeah, it all starts working once that trust is laid.
I love that. Is there any chance you might have one more example in you, perhaps of a situation like the last one you mentioned? Sounded like that client was fairly angry. Have you had a situation where the client might be more on the sad or anxious side and you've used nonviolent communication that you can recall?
I don't, I don't. Here's what I would say about that. We see a lot of euthanasias, and that's always a really highly emotionally charged moment. And there are a lot of euthanasias that we see, especially in emergency, where it's just, there's a financial aspect of it, whether or not it's purely motivated by that or not. But I think that's a really important time to be self-aware of what's happening and think about what the client's emotional needs are. And I always think what they really need. So the pet, obviously, you're agreeing to that because you think that, there's suffering going on that should end. But I think what the client really needs is they need to be sold a story of how they are doing the right thing, because people just get really guilt-racked in these moments. So when you're talking about a euthanasia with a client or performing a euthanasia, I try to think really hard about what are their needs right now. And their needs are usually reassurance and comfort. And you can't do it the same way for everybody, because it's part of good communication is just learning how does this person need to be talked to. But I do try to just reassure them as this is going on. Hey, look, even if we send them to a specialist and did this expensive procedure, and even if that money were there, which it's not, there's no guarantee that this would have prevented the suffering or would have led to this. So yeah, I'm always kind of conscious of that. You can also sort of, if you're in this job for a while, you can tell what people care about. Yeah, they care about their pet. They care. 90% of people plus are going to care about money. They want to know, like, they're not going to bankrupt themselves. They're not going to spend much money. So just listening to them, they will tell you almost everything that's relevant within the first few minutes if you just are really paying attention. They'll mention, oh, I had a friend's cat die under anesthesia for a dentistry. Oh, I had this or I had that. They'll tell you right away. And that just tells you, hey, finances are important. Hey, risk of anesthesia is important. This, and this. It's a much richer way to experience the clients, which unfortunately is like a major problem with our profession is we hate dealing with people and it makes us miserable. And I think this is one of the ways that you can really make it not only more enjoyable for yourself, but provide better care for animals because you're going to have a healthier BCPR.
I always do. Part of my story is that when I was on the vet med track, if somebody had asked me like, well, why do you want to work as a veterinarian? I would say, well, I love animals. And behind that, I was thinking, I really don't like people. And it wasn't until I learned more about psychology and how humans tick that humans became my favorite species. I think I didn't like people because I was afraid of them or I didn't really understand them. Like to read a cat or a dog or a horse felt more natural. It's like, I know what they're thinking. I can see it all over them. Their expressions are true and pure. Whereas a person will say, oh yeah, I'm good with a face. And you're like, you're not good. Like,
yeah. Oh,
right. So I think that's the thing is that as we equip people with tools like nonviolent communication, as you feel more skilled at this, humans become more interesting, more approachable. Like we kind of are full circle back to the beginning of your story where you said like, I wanted to approach the situation. I wanted to know more, like you were leaning towards it instead of away from it. And I'm hoping that people listening today are a bit intrigued, like, maybe this would help me. I would love to face my day walking into the vet clinic thinking, you know what, if there's some challenging clients walking in the door, I am the one that looks forward to handling them. It's a skill set that I am good at and I feel confident about and I'm ready to practice it. And knowing there's a pathway forward with something like nonviolent communication is really, empowering.
Yeah, it can totally change your experience. And yeah, just think of humans as another animal. It's easier to be nice to them, I think, after that.
That's so good.
I mean, but we don't get mad at the cats when the cats scratch. I mean, most of us don't. It's like, it's a cat. It's doing what's natural to it. Well, same with the person in there. And you just got to remember it.
It's so, so true. I think that analogy is so helpful. And I was just going to ask, as we're coming down the home stretch, if for those people listening, let's say again, they're fairly new or green to this idea of nonviolent communication. If you just want to leave them with one or two takeaways from today, if they remembered nothing we talked about this whole podcast, just a couple of gold nuggets to leave here with, what do you hope they remember?
I hope you remember that your experience is unique to you and you shouldn't let anybody get a bad story about yourself into your own mind. You should try to control the narrative about yourself. And number two, you should understand that anybody that's acting in a way that seems aggressive or mean or rude is not doing it because they hate you. Nobody woke up on whatever day you're listening to this thinking, I hate you. I can't wait to go make your day miserable. They're doing it because they're trying to get something and they're frustrated with it. And they're using a childish strategy because they just never learned different or thought about it hard enough. But it's really wonderful to do this and to share it. And people who've experienced it from a partner talking to them know how much better it is. Nobody wants to, we just don't live in a society of people who want to fight with each other all the time. We want to communicate. We're just a bunch of spoiled brats who are trying to, get a parent's attention and then that's okay. And we're trying our hardest.
I really appreciate that. I think that's helped me as a therapist to look at people as the child, the younger child version, because we all have that. I definitely can feel like sometimes I devolve to a 7-year-old. I'm like, okay, here I go again. We can all feel that part inside of us. And I think that empathy that you're extending to each of the clients that walks in your door is really a beautiful thing. And I so appreciate you taking the time today just to share your experience with nonviolent communication. I hope that it intrigues people enough to Google around and start doing their own exploration for how they might be able to bring this into their clinic.
Yeah, this is a super fun chat. I love this topic, so I appreciate a chance to discuss it.
It's clear. It seems like you're very natural with it too. And for those people listening, if they want to learn more about you, including your cartoon journey, what's the best place for them to find you?
I do a weekly blog at sasquatchpod.com. So just that's got all sorts of stuff with my cartoons and just writings about being a vet and writing's about whatever weird thing I'm thinking that week. So yeah, that's the best spot.
Great. I will link that up in the show notes. And Greg, thanks so much for being on this day. It was really, really fun.
Thank you, Crystal.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.